Hello everyone, my name is Santana Wilson, and today I'm going to be teaching you about interventional radiology and how it is a new minimally invasive technique for surgeons. So interventional radiology is basically when a surgeon or doctor or anyone that is trained in the specific field does a small incision and uses imaging to guide a wire or a catheter through your body in order to perform diagnostic measures or treat illnesses and diseases. So, interventional radiology is a newer idea in the medical field. There's not a lot of research on it yet. I did try to find some that were older, but most of it is coming from around the 2020 era stage. So basically, interventional radiology, like I stated before, is whenever they take a catheter and they use imaging to guide it throughout your body. So imagine, for example, you have something called a esophageal varice. This is when your hepatic vein, which is your liver and your main artery through your stomach to your liver, you can get like part of the blood vessels can rupture, and it can cause bleeding, whether that be through vomiting. You can pass it other ways, which is a huge deal. And especially when you're under that kind of pressure, you're the patient or you're the family of the patient, you're thinking, what is the quickest way that we can stop this, and what is the safest way that we can stop this? So I wanted to show these pictures specifically, especially, photos like this that are more simple, of someone inside of a CT or an MRI machine while they're performing the interventional radiology. So say that you do have an esophageal varice and they are using this catheter to guide through your body to stop the bleeding. According to the Yale School of Medicine, this is a very common procedure, especially for embolization to stop bleeding. It can also shrink tumors. It can block blood flow. It can also be used to treat conditions like cancer, vascular disease, and, of course, internal bleeding. So, imagine, once again, that you are the patient or the family of the patient, and you're thinking, what is the quickest and safest way that we can do this that would prevent further issues for the patient or for yourself? So, whenever they're doing this procedure, it's minimally invasive, and usually the cut per se, or the incision, is usually only roughly 1 to 3 inches long, and it's usually in the arm or the leg, normally in the groin, and that's the easiest way for the interventional radiologist to guide the catheter throughout your body. So they're using the CT or MRI machine to make sure that it's in the correct place the entire time. Especially once this procedure is over, it is much easier to recover afterwards. So it's really transforming modern medicine into what was once, possibly a open surgery, like open heart surgery, like fully like an open stomach surgery, an open any kind of surgery where your organs would be exposed. It's turning it into something that is a quicker operation, a faster recovery, a safer recovery for the patient, and you're also allowing the doctors more time to treat more than one person. And I found these images especially interesting because you can see here that they're using, which I believe this is X-ray from the research that I've done, and they're going through the bottom groin, which is down like near your hip, and you can see with this arrow here, they're pointing to the catheter that is inside the body. So instead of being fully open and exposed and doing risk of infection or anything of that sort, they're using minimally invasive, basically all by sight. Frontiers in Radiology also explained how this technique allows doctors to target diseases directly instead of having to do multiple procedures once the patient is already open during surgery. So instead of multiple surgeries being necessary, they can use the image guidance to treat multiple things at one time. It's usually either X-ray, CT, ultrasound, something that the doctor is using to watch the catheter be guided throughout the body. This seriously, genuinely benefits the patient, not only because of the minor incision, but it treats them effectively, efficiently, and saves a lot of time for everybody involved. The healing process especially, makes them less susceptible to infection because the incision is smaller. Because not only can they diagnose through this, they can also treat. But as this technology improves and advances, interventional radiology can be a profound tool for anybody in the medical field to treat and diagnose patients now and in the future.